Dean Laganosky.
In this series of brief videos, we'll debunk common myths about overactive bladder, or OAB, and its treatment.
Here, we'll discuss the impact of OAB on both women and men and briefly explore how Gemtesa, or Vibegron, may meet their needs for symptomatic relief. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of OAB with symptoms of urge urinary incontinence, or UUI, urgency, and urinary frequency in adults, and for the treatment of OAB with symptoms of UUI, urgency, and urinary frequency in adult males on pharmacological therapy for BPH or benign prostatic hyperplasia.
Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions such as angioedema have occurred. Please see full important safety information at the end of this video. Dean, there's a myth that OAB is much more common in women compared to men, and that when men have bothersome lower urinary tract symptoms, or LUTS, it's primarily due to BPH.
Actually, although women report symptoms of incontinence more often, the prevalence of OAB is similar amongst women and men.
This is consistent with what I've observed. I find that OAB, particularly urge urinary incontinence, is more commonly seen in women in clinical practice. Women often report urgency triggering incontinence, and both are hallmark symptoms of OAB. In men as they age, the prevalence of BPH increases, and it's prostate enlargement that leads to the development of obstructive bladder symptoms.
The prevalence of OAB increases in age in both women and men, and OAB actually becomes more common in men compared to women after the age of 65.
OAB is a problem for both women and men, especially storage symptoms of urgency and frequency. In fact, about 50% of men have a combination of storage symptoms related to OAB and voiding symptoms related to BPH. Dean, what's the reason for the difference in reporting of OAB symptoms between women and men?
Well, as we said, OAB can present differently and at different times in women and men, which is one reason. While frequency and urgency are common in both women and men, women are more likely to experience urgency with UUI, and I find that leakage is what most commonly brings patients in to discuss their symptoms. As we said, as many as 50% of men report a combination of storage symptoms typically associated with OAB and voiding symptoms typically associated with BPH, and it can be difficult to tell the difference. Therefore, LUTS due to OAB may be associated incorrectly with the enlarged prostate when it's actually a bladder storage problem.
So would you say that OAB may be underdiagnosed and undertreated in men because we're focusing on the prostate and BPH symptoms and not necessarily looking for bladder symptoms?
Yes, I think we're probably overlooking a lot of OAB in men for that reason. Among men with LUTS, 62% receive a BPH diagnosis and 74% receive a BPH treatment, such as a medication, where only 26% receive an OAB diagnosis and 7% receive an OAB medication. For one, this suggests that more men are actually treated for BPH than are formally diagnosed with it. And it may also indicate that even when OAB is diagnosed, BPH treatment is still often prescribed, possibly because OAB symptoms are attributed to the prostate issues and not the bladder issues.
Both anticholinergics and beta-3 adrenergic agonists are approved for the treatment of OAB in women and men and may also be recommended as monotherapy.
However, Gemtesa is the only beta-3 adrenergic agonist approved for the treatment of OAB symptoms in men, also being pharmacologically treated for BPH.
So in summary, OAB symptoms affect both women and men and should be treated in men even in the presence of BPH. Please continue watching for additional important safety information for Gemtesa, and be sure to watch the other videos in this series.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.